This is Dr. Caudle Miller, and we've been talking about epilepsy, and today we're going to talk about Dilantin. Dilantin is one of the original drugs that we use for epilepsy. It's been out 50 years, and I can guarantee you if Dilantin came out now and it went through FDA approval, it would never be approved. Dilantin came out long before the FDA even existed. But Dilantin is a drug that we've used forever. We still have to use the IV version of it in the emergency room because it could stop seizures quickly if someone's seizing like crazy in the emergency room. You usually use 100 to 400 milligrams in divided doses, and one thing we've always liked about Dilantin, their drug levels 10 to 20, but it has terrible side effects. People that take it long-term get gingival hypertrophy. Their gums just grow over their teeth, so they have to floss every day, go to the dentist about 2 or 3 times a year. It can cause them to be very dizzy, ataxic. Pretty girls can grow hair on their face. And it can destroy the central nervous system. You can get cerebellar degeneration, peripheral neuropathy, spinal cord degeneration. It can suppress your bone marrow and make you anemic and cause a severe peripheral neuropathy. Over decades, Dilantin can destroy your balance center and cause severe cerebellar atrophy. The cerebellum is in the back of the brain. It affects balance. We rarely use it long term. If someone comes in with status epilepticus or refractory seizure in the emergency room, they're put on Cerebrex and Dilantin. When they get to my office, the first thing we do is start weaning them off Dilantin. We never put anyone on Dilantin in the outpatient setting. I don't know how many years it's been, but it's been decades since I put anybody on Dilantin. Always change it. Dilantin also can cause some terrible birth defects, what we call fetal phenytoin syndrome. Eyes very set apart, cleft lip, cleft palate, just a facial expression, and cognitive problems forever. So we do not use Dilantin. Now it's interesting, you have some patients that have, profound intellectual impairment, and they've been on Dilantin and phenobarb for decades, and we try to change them and just can't do it. They start having seizures again. So it's just something that if you can't get a patient off, particularly a patient with profound or moderate intellectual disability, you just follow their liver and kidney function, have good dental hygiene, and you just have to leave them on it. So that's Dilantin. So we're going to talk about more drugs we use for epilepsy. Like, subscribe, comment, and more later.